See important safety information and full aerosol intrathecal baclofen injection prescribing information at the end of the video.
My name is Boster with Ohio Health. Today we're going to be speaking about the ITB test dose, why I think it's important, how it's helped me in my clinical practice, and recommendations for how it can be applied in yours. The ITB test dose is a moment in time after you've discussed the potential possibilities for improving spasticity with a patient and their family before you move forward with the therapy. I always tell people that it's unusual in medicine that we can test drive a therapy before we actually use it. And I oftentimes use the analogy of driving a car. It's a rare person that might buy a car sight unseen. Generally, we give the guy our insurance information, he gives us the keys, and we drive around the block a bit. Driving around the block or test driving a car gives us an opportunity to see how we like it or don't like it. Does it fit? At the end of the test drive, I tell my patients, it's not as if you know everything there is to know about that car, but you certainly have a better sense of what you're going to get out of driving it. In a very similar fashion, an ITB test dose can provide insight both to you and the patient's family and loved ones of what is to come with regards to ITB.
ITB therapy is indicated for use in the management of severe spasticity. Patients should first respond to a screening dose of intrathecal baclofen prior to consideration for long-term infusion via an implantable pump. For spasticity of spinal cord origin, ITB therapy via an implantable system should be reserved for patients unresponsive to oral baclofen or those who experience intolerable CNS side effects at effective doses. Patients with spasticity due to traumatic brain injury should wait at least 1 year after the injury before consideration for long-term intrathecal baclofen therapy.
Today I'll be sharing a case of a patient I recently met in whom we underwent an ITB test dose. Patrick came to see me after he was already seated in a wheelchair. He had seen innumerable different doctors and had never been given a diagnosis for his progressive myelopathy. In sitting and talking to him, the question that I had been asked in consultation was, does he have a form of multiple sclerosis? And during the course of the day, we did in fact clarify that he likely has primary progressive MS. More important, at least at the moment, however, was the fact that as I spoke to Pat, he was writhing in pain. He was spasming constantly as I spoke to him. And each time he would cringe and have to stop for a moment until he could kind of get his whereabouts. This happened non-stop during the course of our interview. Here now, in his own words, is Patrick.
Well, my legs are crossed because it's very difficult. I can maybe get my right leg this far, and they go right back to, I could possibly, you see how hard it is to get them to spread.
You're trying right now to get them to spread?
Yeah. Or if I can lock them out like this, then they're stuck. I can pry them apart like this. If I put my foot, as you can see, it's very difficult. It's like a heat pain. It's like a pain that, like right now, as I'm sitting here, I'm about 175 pounds. It feels as though I'm 300 pounds sitting in this chair. It's like my buttocks are squeezing down on this wheelchair. I can actually feel the bars underneath here. It's very frustrating after being somebody that's, such a physical person. I was always being the most agile, fastest guy on the team. Being a little guy, you had to be the quickest. And now not being able to use my legs is pretty frustrating.
Patrick's test dose started with a discussion. We again reviewed his spasticity and what he had failed and what wasn't working, and we reviewed the goals of what we were trying to accomplish that day. I explained that in many ways it was a yes-no kind of answer. Does bathing your spinal cord in liquid baclofen help your spasticity more than what's currently working? Yes or no? Now, assessing that is not that straightforward. We did an assessment before we got started where we documented how frequently he was having spasms each hour, his numerical rating scale of pain overall. We did an Ashworth scale where we looked at his spasticity. We arranged him. We did manual muscle testing and deep tendon reflexes testing. And we looked at the before picture. We actually took it a step further and videoed this. So it's a quarter till 8. This is before the injection. So bilateral hip adductors are a 4 out of 4. Right knee extensors, 4 out of 4. Left knee extensors, 4 out of 4. Let's go loose for me. He's a 3 here, and a 3 or 4 there. The next step was the injection. And after his back was numbed up, Patrick was injected with 50 micrograms of intrathecal leorsol, done in a sterile technique. The needle was removed. He tolerated the procedure amazingly well. And then we began the period of observation. So this is 1 hour post-injection. So across the right leg, the flexors are a 0. Extensors are a 0. At this first assessment after the injection, we were amazed to find one of his legs had started to relax. He hurt less, and he had almost no spasms or cramps.
He started flexing and stretching me, and he was able to stretch my legs almost to a 45-degree angle. It was amazing.
Possible adverse events of the screening test are drug-related and include hypotonia, somnolence, nausea, vomiting, headaches, and dizziness. Ask your patients to indicate if they experience any of these potential events. A screening test is contraindicated in the presence of an active infection and in patients who demonstrate hypersensitivity to oral baclofen. The screening test may take more than one session over multiple days.
Here we see hour 2. So right hip adductor is now a 2 out of 4, down from a 4 out of 4. 2 out of 4 with the left hip adductor, down from a 4 out of 4. I have no catch. 1001, 1001. He zeros across his knee on the right leg. He zeros across the knee and the left leg. There is a suggestion of contracture of both.
Once the test was performed and he was able to stretch me and pull on me and flex me the positions that I hadn't flexed in 3 years, it sold me without any pain. That's what made it amazing, without any pain whatsoever. You know, it sounds good. Somebody says pump, may work or may not work. I didn't believe it until after the test.
For Patrick, for Patrick's fiance, and frankly for myself, it was a pretty special day. It was a day where for the first time in almost a decade, a man who was constantly in pain had a break from his pain. A man who couldn't uncross his legs was comfortable. And that was pretty special. Based on that experience, we now have an expectation for what ITB therapy can do for Patrick and for his family. We have an expectation for the rigor of therapy in front of us, and we have hope that with this therapy, we can decrease his discomfort, decrease his spasms, decrease his cramps, provide options for positioning and seating, decrease the risk of decubitus ulcers from dependent areas being pressed on, decrease risk of contracture, and together, I'm excited to take next steps.
ITB therapy involves the implantation of an infusion pump and intrathecal catheter to deliver a precise amount of leoresol intrathecal baclofen injection directly into the intrathecal space. Surgical complications are possible and include infection, meningitis, spinal fluid leak, paralysis, and headache. Abrupt discontinuation of intrathecal baclofen, regardless of the cause, has resulted in sequelae that include high fever, altered mental status, exaggerated rebound spasticity, and muscle rigidity that in rare cases has advanced to rhabdomyolysis, multiple organ system failure, and death. Patients and caregivers should be advised of the importance of keeping scheduled refill visits and should be educated on the early symptoms of baclofen withdrawal. The most frequent drug adverse events include hypotonia, somnolence, headache, convulsion, dizziness, urinary retention, nausea, and paresthesia. Adverse events related to device and implant procedures are catheter dislodgement, catheter break, cut, and implant site infection, including meningitis. Electromagnetic interference, EMI, and magnetic resonance imaging, MRI, may cause patient injury, system damage, operational changes to the pump, and changes in flow rate. Pump system component failures may result in clinically significant overdose or underdose. Seizures have been reported and can be associated with overdose, withdrawal, and maintenance therapy. Acute massive overdose may result in coma. ITB therapy and implantation of the pump are contraindicated in the presence of infection or spinal anomalies when the pump cannot be implanted 2.5 centimeters or less from the surface of the skin, in patients whose body size is not sufficient to accept the pump bulk and weight, and patients with hypersensitivity to baclofen. A prescription is required. Important safety information for ITB therapy with lioresal intrathecal baclofen injection. Abrupt discontinuation of intrathecal baclofen, regardless of the cause, has resulted in sequelae that include high fever, altered mental status, exaggerated rebound spasticity, and muscle rigidity that in rare cases has advanced to rhabdomyolysis, multiple organ system failure, and death. Prevention of abrupt discontinuation of intrathecal baclofen requires careful attention to programming and monitoring of the infusion system, refill scheduling and procedures, and pump alarms. Patients and caregivers should be advised of the importance of keeping scheduled refill visits and should be educated on the early symptoms of baclofen withdrawal. Special attention should be given to patients at apparent risk. For example, spinal cord injuries at T6 or above, communication difficulties, history of withdrawal symptoms from oral or intrathecal baclofen. Consult the technical manual of the implantable infusion system for additional post-implant clinician and patient information. See warnings. ITB therapy, intrathecal baclofen therapy, or the Medtronic baclofen pump is a treatment that may relieve some of the symptoms of severe spasticity. People who have severe spasticity resulting from cerebral palsy, multiple sclerosis, stroke, brain injury, or spinal cord injury may be candidates for ITB therapy. When spasticity is due to spinal cord injury or multiple sclerosis, oral baclofen must not control spasticity adequately or have intolerable CNS side effects. ITB therapy may be considered 1 year after a traumatic brain injury. Safety and effectiveness have not been established for children younger than 4. It is important that a patient keep scheduled refill visits to not run out of intrathecal baclofen. A patient must also understand the early symptoms of baclofen withdrawal, including increase or return in spasticity, itching, low blood pressure, lightheadedness, and tingling. A sudden stop of intrathecal baclofen therapy can result in serious baclofen withdrawal symptoms, including high fever, changed mental status, muscle rigidity, and in rare cases, multiple organ system failure and death. It is very important that a patient who experiences any of the above symptoms call a doctor right away. Seizures have been reported and can be associated with overdose, withdrawal, and maintenance therapy. Patients should first respond to a screening dose of intrathecal baclofen before consideration of long-term infusion via an implantable pump. A patient should not receive ITB therapy if the patient has an infection, is allergic to baclofen, has a body too small for an implantable pump, requires a pump implant deeper than 2.5 centimeters, or in the presence of spinal anomalies. Implanting the system has possible risks, including infection, spinal fluid leak, and headache. Pump or catheter problems can lead to pump stall, or dosing programming errors may result in clinically significant overdose or underdose. Acute massive overdose may result in coma and may be life-threatening. An alarm will sound if there is a problem with the pump or if the pump needs to be replaced or filled with baclofen. Educate patients to always inform healthcare personnel of the implanted infusion system before any medical or diagnostic procedure, such as MRI or diathermy. These may cause patient injury, system damage, operational changes to the pump, and changes in flow rate. The most common drug-related side effects of ITB therapy include hypotonia, somnolence, headache, convulsion, dizziness, urinary retention, and paresthesia. Intrathecal baclofen may cause drowsiness. Use of intrathecal baclofen with other CNS depressants and alcohol may increase drowsiness. Titration is required to determine the best dose for treatment. Patients and all their caregivers must receive adequate information regarding the importance of keeping scheduled refill visits and should be educated on the early symptoms of baclofen withdrawal and overdose. A prescription is required. Not everyone responds to ITB therapy in the same way. Patients should always discuss the potential risks and benefits of the therapy with a physician. Healthcare professionals must review the product technical manual and full prescribing information prior to use for detailed prescribing information. Please refer to the full prescribing information about Medtronic ITB therapy accompanying this video. You may also call Medtronic at 800-328-0810 or visit Medtronic's website at professional.medtronic.com/ITB safety.